Today I have published the inquiry's second report. It follows the inquiry's investigation into core decision-making and political governance across all four governments of the United Kingdom. It addresses the pandemic response in all four nations and includes a detailed examination of core decision-making in Scotland. It draws upon the 3 weeks of evidence I heard in Edinburgh in early 2024 for Module 2A. I have compiled one report that analyses the different decisions made by each of the four governments in responding to the same emergency. The report identifies the most important lessons for responding to future UK-wide emergencies. I will now speak to a small number of my findings and recommendations that are most relevant to Scotland. The inquiry found that the response of all four governments repeatedly amounted to a case of too little, too late. The initial response from the key decision makers across all four nations lacked urgency, treating the emerging threat as predominantly a health issue. The Scottish Government failed to engage swiftly with the threat posed to their nation and were over-reliant on the UK Government to lead the initial stages of the response. In Scotland, COVID-19 was still being discussed under any other business in Scottish Cabinet meetings as late as the 25th of February 2020. Following the mandatory lockdown across the UK in spring 2020, the Scottish Government adopted a more cautious approach to the relaxation of restrictions throughout summer 2020, by contrast to England, even though Scotland was in a relatively more positive epidemiological position. This created a greater prospect of further lockdowns not being necessary, or if they were, not being necessary for so long. In the autumn, infection rates varied significantly across the UK, leading to more divergence in approach as all four governments tried to manage increasing rates at a local level. The use of stringent, locally targeted measures to deal with outbreaks meant that cases grew more gradually in Scotland than in other nations. As a result, Scotland avoided the need for a second lockdown in November 2020. Nonetheless, all four governments failed to give sufficient attention to the prospect of a second wave of the virus, with only limited contingency planning in place for reintroducing restrictions. By late 2020, along with the other nations of the UK, the Scottish Government failed to take decisive action in response to the entirely foreseeable Alpha variant. Instead, they pressed on with plans for relaxing measures over Christmas while cases grew rapidly, only to change course on the 19th of December when levels of infection became critical. The mistakes of February and March 2020 were repeated, so that the government saw a return to lockdown restrictions once again as unavoidable. That was inexcusable. By the time the Delta variant emerged in March 2021, all four governments had learned from previous experience and delayed the relaxation of restrictions in response to rising case rates. However, the emergence of the Omicron variant at the end of 2021 and the sheer number of infections demonstrated the potentially disastrous consequences had vaccines been less effective or the variant more severe. In Scotland, key decisions were often concentrated within a small group of ministers and advisers led by the First Minister. This diminished the role of the Scottish Cabinet, which frequently became a decision-ratifying body and not the ultimate decision-making body that it should have been. Although officials in the Scottish Government and the UK Government had good working relationships, there was a distinct lack of trust between the First Minister of Scotland and the Prime Minister of the United Kingdom at the time. This affected intergovernmental relations at a time when effective collaboration between the administrations was paramount. Legislation and enforcement of restrictions was inconsistent across different areas of the UK. The introduction of localised restrictions made it very difficult for the public to understand what rules applied to them. In conclusion, I've identified 19 recommendations that should inform the UK's response to a future pandemic. They include, but are not limited to, establishing structures to improve the communication between the four nations during an emergency. These structures should aim to minimise the risk of confusion caused by similar but different rules being implemented in each nation, seeking alignment of approaches where desirable, and providing a clear rationale for differences in approach where they are necessary. Broadening participation in SAGE through open recruitment of potential experts and the attendance of the devolved administrations to ensure that advice to decision makers draws on a wide range of expertise. The inquiry also recommends extending the principles of transparency of scientific advice to other forms of technical advice provided to the government, so that the public can understand the range of factors beyond scientific advice that influence decision-making during an emergency. This is an inquiry for all four nations of the United Kingdom, and I was pleased that the inquiry held its public hearings for Module 2A in Edinburgh. I would like to thank all those who assisted the inquiry's Module 2A investigation, particularly those who were bereaved or suffered hardship or loss as a result of the pandemic. Further, no less important aspects of how the UK government and the devolved administrations responded to the pandemic will be addressed in the inquiry's remaining reports. I expect that the recommendations in this report will be acted upon and implemented in a timely manner to better protect the people of Scotland and the rest of the United Kingdom. Unless the lessons are learned and fundamental change is implemented, the human and financial cost and sacrifice of the COVID-19 pandemic will have been in vain.